Hey guys, this is Dr. Devon Coughlin with Revolution Chiropractic, and today we're going to demonstrate how we adjust a pregnant woman, and we're going to use Jill as our demonstration here. Jill's 30 weeks pregnant now, and before Jill lies on the table here, we're actually going to be using what we call a pregnancy pillow, and there's a cutout here that helps her lie on her stomach so that her stomach's not being compressed against the table. There's some nice room in there, and we're going to do our Webster's analysis and adjustment for you on video here. So Jill, you can come on over here and get positioned. I'm going to bring the head cushion up just a little bit there. Good. And are you comfortable there?
Yes.
All right. So the whole analysis, we start with the woman lying face down. That's the first thing that we're going to do. And then we're actually going to come back here and check the leg length. And so a lot of times when there's a problem in the pelvis or with the round ligaments, it's going to cause a twisting of the pelvis, which is going to cause one of the legs to come short. And so when we start by analyzing that, we're going to note whichever leg appears short. In this case, the left leg appears just a tiny bit shorter than the right. And then what we're going to do is we're going to bring the heels up towards the butt, and we're looking for resistance here. And so Jill's just relaxed there, and what I'm doing is I'm bringing the heels up, and I'm naturally getting more resistance on this left side. And again, that was her shorter leg. And what's happening with that shorter leg is that the sacrum has rocked backwards. And so when it rocks backwards on this left side, our job is to go back and put that back in place the way it needs to go to create a much more balanced situation of the muscles and the joints in the low back and the sacroiliac joints. And so there's a couple ways we can do this. The one way we can do this, which we often do, is with a drop piece. And so you'll see here, the table comes up like that. And then what I'll do is I'll put a little bit of pressure in here, and then her sacroiliac joint, her sacrum, will drop back into place. And so I'm going to do that a couple more times here, just like that. And then I'm going to come back and check to make sure that those legs balanced out, which they did. And we're going to come back here and check the heels again. And I'm still getting a little bit of resistance on this left side. It's better, but I'm going to go back and do that. All right, so the second part, that was the first part of the adjustment. We adjusted the sacrum back into place. And the second part here, we're going to check the round ligaments. All right, and so we had a problem on the left side of the sacroiliac joint, and now what we're going to do is we're going to first check the right round ligament. One of the biggest problems we see in a breech presentation, or even just in pregnancy, if women's having pain or sciatic pain or back pain, what we're looking for there is actually like opposite sides of there being a problem. So what I'm going to do is I'm going to find Jill's belly button here, and I'm going to come to the top part of her pelvis here, and I'm going to come in between. I'm going to find that round ligament, and I'm just going to put some gentle, steady pressure in there. A lot of times it'll be tender. Is that tender right now? A little bit. And so the round ligament's actually, it's a ligament, but it's also covered in muscle. And so it's actually treated more like a muscle. And so I'm just putting like some steady pressure in here to help that release. And as that releases, it's going to help take some of the torque out of the pelvis. Because the round ligaments, there's one on each side that suspend the uterus up in the air as it gets larger and the baby grows in size. And so if one of these is over-contracted or tighter than the other side, it's going to create a twisting of the uterus, which is going to, again, contribute to a breech presentation or just really a difficult birth. So we want to make sure that we're balancing everything out. That's the whole premise behind the Webster Technique. And we see really, really good results. A number of studies show 82% success rate in helping the baby get in the proper position. And that's with a woman presenting to a chiropractor with a breech baby. So it's not that we're turning the baby. In fact, we're not really touching the baby. We're just working on mom, pelvis and round ligaments here. And that is a Webster adjustment. I'm going to go ahead and finish adjusting Jill here, the rest of her spine, but that's the Webster analysis there. It's been Dr. Devon Coughlin, Revolution Chiropractic. Make sure you watch for more videos and tips. This has been the Webster Technique video.